Go.
Good morning, Mrs. Pass. I'm Emily, and I'm the student nurse who will be performing care for you today. Can I have you confirm your name and date of birth for me, please?
Lillian Pass, 6/21/1989.
All right, that checks out. Okay, Mrs. Pass. Today I'm going to be inserting a foley or indwelling catheter, and this catheter will go straight to your bladder and help release some urine so that we can relieve some of the pressure you've been feeling there lately. This procedure can occasionally be a little uncomfortable, but we're going to do this as quickly and painlessly as possible. I'm going to go ahead and raise your bed to a comfortable height. And then before we get started, do you have any allergies to iodine or latex?
No.
Excellent. All right. Perfect. Okay, Mrs. Pass, we're going to start off by cleaning your perineal region. I'm going to have you kind of spread your legs, lift them up and outward, if that is okay with you. All right, is that comfortable for you?
Yes.
Good. And then I'm going to go ahead and clean off your vaginal area. You know what? First, we want you to be as comfortable as possible, so I'm going to go ahead and put this waterproof pad underneath you so you can keep your bed dry. Sorry about that. Okay, there we go. Now we'll start cleaning you. Surrounding areas. Okay. Then I'm just gonna pat you dry here. You still doing okay?
Yes.
Good. Move this out of the way. And now I'm gonna set up my sterile field. Get some hand sanitizer. I'm going to set this up right here on the bed. I'll start by putting on my sterile gloves. Okay. And now I'm going to put these drapes underneath you just to allow for a little more protection there. And this blue one as well. Okay. And I'm going to choose not to use the finisher to drape for you today. I'm going to set up my tray now. And we already confirmed you had no allergies to iodine, so that's perfect. I'm going to squeeze my lubricating jelly there and put some iodine over these cotton balls. And then I'm going to fluff up my cotton balls. Okay, and then before I clean you off, I'm just going to go ahead and attach my syringe to the catheter itself. Okay. Now I'm going to go ahead and clean you off. Still doing all right?
Yes.
Okay. Okay, Mrs. Pass, now I'm going to insert the catheter itself. I'm going to lubricate 1 to 2 inches with the lubricating jelly here. And then I'm going to go ahead and have you take deep breaths as this goes in. Okay, urine flow has started, so now we're going to go in a little further. Okay, we're sure we're in the bladder. Now I'm going to go ahead and inflate the balloon here with water. About 5 milliliters. And then remove the syringe. Go ahead and pull this out a little bit. I have meat resistance, so I know that it is correctly in the bladder. Now we'll secure this to you in just 1 moment. I'm going to go ahead and clean up my area. Okay, and change my gloves. You still doing okay?
Yes.
Go ahead and put your legs back down. You can relax them. Alright. I'm going to secure this to your thigh with the thigh strap. Is that comfortable for you?
Yes.
Too tight? Alright, and then I'm going to secure this to the side of your bed here. Get that tubing out of the way. Alright, and then we'll get you comfortable. And then Mrs. Pass, that'll stay in until we get a doctor's order to remove it.
Okay.
Okay, now a few days have passed, and it is in your orders that we're going to remove your catheter. So, is that okay with you?
Yes.
And then before I remove your catheter, I'm just going to assess your urine output here. Put this pad down on the floor in case there's any spillage. And then go ahead and drain your bag here. Okay. You assess your urine. There's about 500 milliliters. The color is pale yellow, and there's no detectable odor. We go ahead and dispose of this as facility policy. Okay. And now I'm going to change my gloves real quick and begin with your catheter removal. Okay. Alright, this is passed. I'm going to pull back your blanket here. Again. And your gown. And I'm going to remove this from your leg here. legs up again, just like we did before. Upward and outward. And oops, I didn't quite detach that. There we go. Okay. Alright, Mrs. Pass, I'm going to go ahead and put this pad underneath you. A new pad underneath you. Okay. And I'm going to go ahead and deflate the balloon here. I'm going to let gravity deflate that for us. Okay. All right, Mrs. Pass, I'm going to have you go ahead and take deep breaths. Very good. And that's the procedure. Can I assist you in performing perineal care, Mrs. Pass?
No, thank you.
All right. Pull your gown back down. Your blankets up. Alright, Mrs. Pass. I'm going to go ahead and lower your bed here. The wheels are locked. Your call light is right here beside you. Is there anything else I can help you with before I leave?
No, thank you.
Alright, we'll be done here in just a second. Alright, Mrs. Pass, you have a great rest of your day.
Thank you, you too.